Good afternoon, everyone, and welcome to Spiritual Health Grand Rounds at Emory University. My name is George Grant from the Woodruff Health Sciences Center. Today we have a special program, and the topic is racial disparities, forging toward sacred worth. Our moderator today is Bridget Piggue. Dr. Piggue is the Director of Spiritual Health at the Emory University Hospital, Midtown. She received her doctoral degree right here at Emory University. She is nationally known in racial leadership as well as the spiritual health field. And we're very pleased and privileged to have her on our team. Bridget, take it away.
Thank you, Dr. Grant. I appreciate the opportunity to lead here and to welcome all of you who are a part of this webinar Zoom cast today. We are looking, as Dr. Grant has shared with us, at racial disparities in healthcare, forging solutions toward a sacred worth. For those of you who don't know, who may be on the call, we are spiritual care, spiritual health and spiritual care responders. We provide this type of support and walking with in our healthcare system. And so many of you are aware of what might take place in our hospitals across the nation, across the globe. And so we want to join the conversation and allow Dr. Nicole Franks and Ryan Wilson to join us in helping to lead the conversation. Let me first of all just give a little bit of information about our speakers today. We want to thank them for being present with us. Dr. Nicole Franks, many of us who work in the healthcare system are familiar with her. She is an MD here at Emory Healthcare. She is in executive leadership. She is the Chief Quality Officer at Emory University Hospital, Midtown, an associate professor of emergency medicine at Emory University School of Medicine, an Emory Healthcare board member, and a practicing physician. She has co-founded Emory's Administrative Fellowship in Emergency Medicine and currently serves as the program director. Now, if any of that information is different, Dr. Franks, you can help us to know that. I'm going to ask you to also share anything more that you want to make sure we know and understand as you begin to share with us. And Ryan Wilson is the founder and CEO of The Gathering Spot. And what I understand about The Gathering Spot, it is a place, they have found it together. You have a partner as well. I'd like for you to share with us his name once you begin to speak. But understand you gather people from all walks of life, and there is a social component, creative component, professional, and future self, that these creative minds come together, and the mission is to create a world where the opportunity is the byproduct of community and collaboration. And so I know that when you were asked to be a part of the panel, you wondered if speaking in this particular area was something that you could really offer your expertise. And Dr. Grant share with you that, we would love to hear your perspective on the social determinants of health and the uneven access and racial bias that may certainly been a part of some of the conversations that you've had with the great minds that you've pulled together. So just want you to keep that in mind. And I'm going to go ahead and maybe perhaps let Dr. Franks lead off, and I'm going to offer her a question as a way of just framing the conversation. But once you begin speaking, I'd like for you to introduce yourself, and I'll come back around to you, Ryan, if that's okay.
Works great.
Okay, wonderful. And so, Dr. Franks, I'm going to begin with you, and we will, for those of you who are attending, we will have a time after they are speaking for you to place a question in the chat, and we'll see if we're able to fill that for you and have our speakers to address them. Okay, so just keep that in mind, and you don't need to flood the chat right now, but why don't you write it down to the side, and we'll come back around to you. Okay. So Dr. Franks, I will begin with you with this question, but please introduce yourself as well. So some of the focus here in our topic, diversity, equity, and inclusion. Those are central components to a lot of what we'll be discussing. And so I want to say these are three very powerful words. And if repeated often enough, I thought could run the risk of being missed or unfortunately relegated to a good slogan, being just a good slogan. You hear that repeated enough. So because they are such powerful words and so much more than a slogan and critical in our work as care responders, would you be willing to share very practically the meaning of those words and the reality of their importance in regard to healthcare and the well-being of the people we are speaking about, particularly marginalized communities?
Sure. Thank you so much for this opportunity to be a part of this forum. And I'm looking forward to the conversation. Um, so I am an emergency medicine physician. I have been with Emory pretty much my entire career. I did residency here as well as have been on faculty since that time, and been in executive leadership for over the past 8 years. And so as a quality leader, equity resonates with me the most. And I'll talk a little bit about why in just a moment. But you asked me to specifically speak to diversity, equity, and inclusion. And the first thing I'll say is those words, diversity, simply put, is difference. Equity is fairness. And inclusiveness is just valuing all, right? And making everyone feel comfortable in any space. And I think when those words came out, and it's interesting that we actually have to name those words. And because people might think, well, you know, is it okay to be different? Why do we have to call that out? Why do we have to be intentional about that concept? And you know, fairness, it seems to be something we aspire to, at least I hope most of us do, but quite frankly, that's not really the case. So we have to, again, name it to achieve it. And then finally, inclusiveness, or really valuing everyone and making everyone feel comfortable, again, can't be assumed. It has to be intentional, it has to be named. Often when, at least in the context that I've come into the space of speaking about diversity, equity, inclusion, it's in more around really as an executive leader, the business case, right? So it would seem, I would hope in sitting in spiritual grand rounds that from a moral aspect, it makes perfect sense. This is what we strive for. But it's not everyone has the same values, unfortunately, or philosophy towards things. And so, but what seems to resonate in some forums that I've spoken about diversity, equity, inclusion is the business case. And really, if we want to grow, if we want to expand, if we want to be innovative, and this has been proven in just about every industry, having different people with different perspectives around the table is the way to grow, is the way to be innovative, okay? And if you want to keep those people in your organization, they have to be shown that they have a safe space, that they are included in the conversation, that they have a fair opportunity to achieve and grow within that space. And if all that is allowed, they're going to bring their best self to work every day. And then the organization benefits. So the concept of DEI in that context resonates, I think, with some. And it's important, you know, I say that as an example because it's very important to meet people where they are in all concepts. And just because they don't value the sacred worth or moral aspects of diversity, equity, inclusion, it's going to resonate with everyone in some form or fashion. It's just about meeting people.
Your last words just went out. I don't know if it was just me, but
Oh,
people.
Yeah, it was just really reiterating that we want to make sure that the concept of diversity, equity, inclusion, when we talk to different people about it, they may not always value it from a moral standpoint or a sacred worth standpoint or the right thing to do. And we have to make sure that we frame those concepts in a way that they can hear the message.
Gotcha. Thank you, Dr. Franks. What I will do is ask Ryan a similar question in terms of just a baseline and kind of laying a foundation so that the rest of what you share as we look at your experiences with these inequities in healthcare and that we're all on the same page, understanding where you're coming from when you think about diversity, equity, and inclusion. So if you would like to introduce yourself in that way, Ryan, and more.
Sure. It's good to be with you all, and I was joking with one of my my friends before I joined this call. So I'm a lawyer by training, and one of the jokes in law school was the lawyers are doctors that are afraid of the sight of blood, and so I am very grateful to be here with you. My experience is a little different. So I'll talk a little bit about my background. So I'm originally from Atlanta, but spent a good amount of time in Washington, D.C. I went to Georgetown for undergrad and for law school. And it was while I was here that I was able to be involved with a lot of different movements centered around diversity and inclusion and social justice broadly. That work led me to starting a business that is a private club that's based out of Atlanta called The Gathering Spot. Tell folks the best way to understand what we're doing at TGS each day is we're connecting people far more than being in the space business. We're in the community business. The youngest member of our community is 21. The oldest is 88. And my job each day across those that are identified as entrepreneurs, some that are creatives, others that work for some of the largest companies in town, is to make connections across traditional lines of difference. If you have been to country clubs or city clubs, really throughout the country, there's normally an industry focus and an age barrier that exists. Our goal was to try to make sure that those traditional barriers were not going to be part of the experience at the Gathering Spot. And so if you come to our restaurant, you will see people that wear t-shirts and jeans sitting next to folks that wear suits and ties. And our belief is that that really is where the magic happens, when we can get communities that wouldn't have met one another or ordinarily to be able to talk. One of the ways that we do that is through programming. We program about 30 times a month on different topics, blending both the professional but also the social interests of the membership in those programs. And so what does that have to do with diversity and inclusion and justice? Some are probably thinking. To us, this is a rather simple approach to approaching these issues, but what I found after the university context is that I really didn't have communities where I could meet people that were interested in different things, where thought leaders were being brought. If I look back to that experience in college, there was a different speaker on campus pretty regularly, even though I didn't appreciate the thought leadership and probably didn't take advantage of all the opportunities of folks that were visiting us. I missed, once I didn't have access to any of it, not being able to be in community in that same way. Through fundamental conversations, we have been able to bridge divides, introduce, again, folks that have had very different opinions about the best path forward on a given issue to one another, and through the day-to-day life in the club, begun to draft our policy measures and introduce those measures to elected officials with the goal, again, of advancing different issues across various finish lines. So I'll stop there, but it's, again, very, very good to be with you. And I look forward to sharing all that I can about our work at the Gathering Spot.
Thank you. So, Dr. Franks, as we move very a little more focused on racial disparities in healthcare. I wanted to know if you would help to lead out in this conversation. I know you've had an opportunity to speak to very specific issues that arise. We are in a COVID world right now, so things are even more pronounced that were always there. It's almost like the cover has just been ripped off, and we see it in clarity in ways we never have before. And so, as you just take your time to share with us in the way you've prepared, I want to just reference something I read about you in an article, and just like to again lead in to what you'll share with us. But you stated very powerfully and very positively as a leader that you want to be able to leverage any influence that you have, and I consider influence power. Any influence you have to advocate for the values of diversity, equity, and inclusion. Can you provide, as you share, any practical examples of how you are able to do that given all that is challenging in this area?
Sure. You know, I stepped into this space of really speaking even more on topics of diversity, equity, inclusion, first around gender diversity and women in leadership. And then as COVID-19 hit and the revelation of the inequities, the racial injustice that had been in existence was now, you know, just amplified in a space and time where everyone had to pause, and you really weren't in a position to not have your awareness raised in some form or fashion. And so stepping into that conversation as a board member initially is how I started really becoming more engaged in leveraging, you know, the seat that I have. A charge from the Emory Healthcare Board by one of our members around COVID-19 is hitting my community as an African-American gentleman, and said, what is Emory doing about it? It was just simply that. And so in our response, not just as an Emory Healthcare board member, but also as an emergency physician who was taking care of patients directly during this time of unknown. Also, I saw people of color being disproportionately affected. And so I wanted to be able to step into that space and be able to raise awareness and help everyone with that call to action. And where I start with those conversations really is about, you know, not just saying, you know, Black people are, or COVID is more prevalent in Black people than white people, or it's more Black people than white people are dying. It's really about, you know, well, why is that happening? And quite frankly, it's just a way to start the conversation, to bring everybody back to the concepts that have been there for over 20, 40 years, that have been discussed, that actually have priority and programming behind it, like Healthy People 2000 is where it started, and Healthy People 2010 and 2020, that actually call out disparities in healthcare and have a burning platform for actually closing those gaps. And that it was rooted in our departments of health and human services, our quality think tanks like the Institute of Medicine, the Institute for Healthcare Improvement. There's experts who have been talking about these concepts for quite some time. And right now there's I think the groundswell around COVID, around the images of racial injustice, and quite frankly, the younger generation who has had enough, or who won't stand for it, and is stepping up in a new way to lead the charge. And so this groundswell and this attention, you know, the time is now, and we have to act. And so one of the things, Dr. David Williams is a Harvard public health expert, a public health expert at Harvard, and in racial equity and health equity. And, he was asked in a conversation by another quality leader, Don Berwick, why haven't we achieved health equity? Why are we struggling with that? And he put it in the context like this. He said, well, first, people aren't aware. They don't see how that meets them where they are. They just don't know. And it's not because they don't want to, it's not, the information is not there. It's just their perception, point of view, and priority. The second is we haven't had the political will really to do something about it meaningfully. I mean, we've had this programming over the past 20 years, but not everyone is bought in. And finally, there's really been no emotional connection to the problem by everyone. And that's why I think what has been going on with COVID and having technology in the state that it's in, information is not filtered. You can see it in every format. There is no hiding, there is no cutting, pasting, and massaging the information that's coming to us. And there's so many drum majors out there in various formats who are letting us know what happens. From the person with the phone on the corner to, the Pulitzer Prize writer who is writing about these concepts. So, the emotional connection, I feel, to move forward and meaningfully address the inequities and the social determinants of health that are driving these disparities is this COVID pandemic. And it's not that we haven't had these chances before. We've had Hurricane Katrina. We've had plenty of chances. We actually know what to do to close the gap, but we haven't had the will to do it. And so, I step into this conversation thinking about those things and thinking about, well, where do I sit and what can I do? There's going to be those who are going to lead a rally. Some are going to write, about it daily in a communication, but where do I sit and what can I influence? And so that's the charge that I have to myself. So as a quality leader, health equity is one of the aims of quality care. That our care that we deliver is provided equitably. So are we looking at the data? Are we aware of the data? Am I working with our analytics team to make that more transparent, to help address that conversation? Are we looking at the data beyond just race comparisons and really looking at the why behind it and saying it's not just Black people versus Hispanic people versus Asian versus white people. It is Black people who live in this neighborhood who have this opportunity fare this way versus Black people with this different opportunity, and we're comparing within groups. So there's just a lot of opportunity that we have to better inform ourselves and not use proxies and really dig into the why behind why these disparities are happening.
Thank you, Dr. Franks. Two words just hit me very hard when you said not having the will to do it. That's heartbreaking. When a person is not experiencing what another may be experiencing, it's just out of sight, out of mind, not my experience. That's heartbreaking. And then the reality that this is a systemic issue. It is not a linear kind of one issue, a problem. There's so many layers to it. So thank you for raising those. And Ryan, I'd like to invite you into this conversation as you're looking at the social issues and the conversations that are being had. You have young people taken to the street and making sure that they are not being silent. Can you chime into the conversation at this point?
Sure. I mean, I think that Dr. Franks is exactly right. I mean, these are systemic issues that we have to address holistically. One of my favorite quotes in life is, "Do you really want to win or look good losing?" And it has been a quote that I have had to offer in many settings over the course of this year, because I think that particularly in the space that I work in, most frequently when talking to larger corporations and with small businesses, we've got to ask some tough questions about what the path forward is really going to look like. And I would imagine, although I don't practice formally in medicine, that it's that same question can be asked here. Do we really want to win or look good losing? If we want to win the fight, and I'll go back to the context that I know, I mean, and use use an analogy from the small business or startup context. But it is interesting to me that the frame that we use when in discussions about diversity inside of organizations really starts with research. Now, I'm not saying that research is a bad thing, but I challenge that some of the largest organizations and some of the best organizations in the world at what they do, if they really wanted to move the needle on these issues, could do so, right? And so how are we now several generations into a discovery process? And again, I'm not saying that research is something that we shouldn't do as we approach to solve a problem, but at some point we've got to move that conversation into action. And so my concern is that until we can begin to have plain discussions with one another to really get to the root of the causes of some of the social ills that we discuss often in these settings, that they'll continue to go on. The last thing I'll say, and I was giving it was an interview for fellowship when I was in college, and I asked a question of a student that was pursuing the fellowship: what is the difference between social justice and service? And I wasn't prepared for her answer, and she wasn't able to give me where this quote came from. But what she said is, if you approach a river and there are dead bodies floating down the river, service is to go into the river and to pull the dead bodies out. But if you're interested in justice, you must go to the top of the river and figure out where the bodies are coming from. And so I think that's what this moment commands. We've got to go to the top of the river, figure out where the bodies are coming from, and then really begin to, again, have tough discussions about what we're going to do next. I'd offer, though, that in the majority of the discussions that we're in, unfortunately, there is more of a commitment to continuing to look good losing than there is a commitment to actually win. But I believe that in most instances, because we're talking to some of the most brilliant people and organizations, that we can get there. I think we've got to start again from that very simple frame that it's possible to get to that, to this place. I don't know if I don't know if there's ever I don't remember what you call it in a racetrack of a line where you cross and win, but I do think that there is meaningful progress that we begin to encourage one another to get to. So do you really want to win or look good losing? I think is the question that we need to be asking a lot of the organizations that we're part of.
So I want to say, Ryan, thank you for that term. I'm going to start using it, and I'll give you credit. Do you want to win or do you want to look good losing? But the reason why, but I want to pick up on one of the things you said is around the root cause of all of these issues, right? And the root cause is the uncomfortable topic of racism, right? And so, part of what has been going on has also been, how do we help people with their awareness? Because how we've been taught about racism is part of the problem as well. And so, first breaking that down, and there's many people who have defined this concept. But I want to start with, I personally like Dr. Kamara Jones's version of definition. And she says that racism is a system. And that's what's important, is to understand that it is a system. It is not a person, not a racist. We are talking about racism as a system of structuring opportunity and assigning worth based on the social interpretation of how one looks, and social interpretation meaning race. And just the understanding the concept that race is a social assignment that has been manufactured and intentionally used to achieve gains and disadvantage some and advantage others. And so, we have to understand that, we have to own that, and we have to understand that that's part of our culture, right, wrong, or indifferent, whether you were there in the original conversations or not. And in some way, everyone has been impacted. Everyone, white, Black, Asian, Latinx, has been impacted by that concept of race and racism. So we have to own that. And once we own it and we understand that there's levels of racism, personally mediated, which is usually the form that everyone fixates on, that involves prejudice, assumptions, that lead to discrimination or discriminatory acts, right? That's what most people think of when those words are used. But really, what is driving and reinforcing how people act in a personally mediated way, whether it's intentional or unintentional, is the systemic or institutionalized uh, racism, is systemic or institutionalized racism, where there are structures that are put in place to unfairly advantage one group or in disadvantage another group. It's just that simple. And it is prolific in all institutions. An institution is housing, an institution is healthcare, an institution is education, an institution, I would dare say, is even the church and faith-based organizations. So it's everywhere, right? And the way that we address the problem, as Ryan said, is you have to get to that root cause. We have to address that and eliminate racism as the force that's driving these decisions and these structures. And the way that we get there is everybody has to own it. We have to understand that this was a system that was intentionally put in place. And we can walk through that history. We need to reteach the way we present our history as a country, because it's not teaching that racism was part of how we got to where we are today in the intentional way that it is. It's alluded to, it's rebelled against, but it's really not clearly laid out, and we need to own it. And so until we're ready to own that and close the gap, we're not going to meaningfully address the inequities that exist in all of those institutions. We're not going to really reach that goal of sacred worth, or really uphold that philosophy of sacred worth, if we're unwilling to do that. And so, anytime I'm asked really to have these conversations, I try to, because again, to your point, Bridget, we have to leverage our influence, our powers in the way that we can to meet people where they are, to have these conversations. And if I can have that conversation in a safe space or provide a safe space, I want to make sure that I do that. That's my call to action as well.
Dr. Franks, I just want to pick up on the own it piece. I think that's exactly right. But to the institutional part, individual ownership, I think that if this moment is not used for us to have a conversation, that it's really about collective ownership of these issues and not your individual feelings. I get very sad every time we have a very strong reaction to an individual person's comments or thoughts, although in most instances probably distasteful in some way. What we fail to do in many of those moments is to again attack the root cause that's at the center of their comments, and at the structure that is helping to perpetuate whatever the comment is. So if you look at, our business is on the west side of the city in Atlanta. If I look at the neighborhood that is directly across Northside Drive, the median income is $28,000. If you spend time in the neighborhoods across the street from us, I'm on a board of a school that actually shares the same road as us on North Avenue. And I went to have a conversation about a literacy program. And in the middle of the discussion, I was talking to one of the teachers at the school. She said to me, Ryan, there's actually no real way for us to do this program. And I said, well, why not? Why? I have a community of folks that would love to volunteer. We'll be here as often as you need to. And to make a long story short, the students were hungry and did not have access to food past lunch. And so, although I was there to talk about literacy, we couldn't get to that work because we had to address hunger. When you dive in there, it's true. We weren't talking about one student or two. The majority of the students at the school didn't have anything to eat after about 11:30. And so for the better part of 3 years now, we have been providing dinner every single day for every student at the school and for their siblings. Now, I don't say that, but for anything to offer that again, we've got to sometimes adjust.
Mhm.
And when we're looking at a system, right, these students have had very little opportunity. I'm a big believer in it's hard to become something that you haven't seen before. I'm an entrepreneur in part because my parents are entrepreneurs. But the system that exists, that basically, if you look at the stats, will, and this is hard to on an individual level when you're working with these students, to acknowledge, but that the system that exists statistically is going to have those students live in the same socioeconomic condition that they live in now. And that to me is where the conversation has to stay focused, not about our individual thoughts and beliefs and feelings and how many friends we have of different backgrounds, although those things are nice. We've got to keep this conversation focused on how do we make sure that the systems that do not work for people, in large part, begin to adopt new practices to give everybody an opportunity to be successful, and you know, in whatever way that you know you want to measure that in our communities.
Thank you, Ryan. I appreciate you and Dr. Frank's conversation together. Um, the group think is so important in this regard. Again, it's the investment that a group would have to really leverage and use their influence and power to make a difference. I had some tough conversations as the um, the boom that has really erupted around the country around George Floyd's murder. Um, I think there seemed to be a real emotional impact that reverberated throughout the nation and globe. And there was something about this devaluing of humanity. We're talking about sacred worth. There was a rendering somehow of the lack of sacred worth that could be seen in the eyes of the one imposing the violence and the pain. I think there was something that struck deep in people's humanity that caused the ripple all of a sudden, for people to grow more conscious. Not that there hadn't been people who were conscious, not that people hadn't been speaking and writing and talking about this for years. Somehow it was an awakening in this moment, like there have been at points in time. I'm wondering, for the two of you, given um, the the awareness, when you are interfacing with those who hold power, when there are those who might say, well, I'm not of a marginalized group, so I don't know what to do. When you encounter that, what I have found myself doing is to say, understanding your power and your influence and your ability to use it in ways that can make a difference is what I'm looking for. I'm not telling every person who is not in the marginalized group to read every book, to know everything, though it's good to gather the information. But how do you center yourself enough to know that you have the power to actually do something about it? And then I see us working together in that regard. Are you able to make those type of challenges to those who are in your sphere to move forward and make a difference?
So yeah, I actually, that was probably one of my reactions to George Floyd. Is I'm an action oriented person, so I wanted to leave people with things to do. And you to some extent outlined that. You know, the first thing is be an ally.
Mm-hmm.
Right? And the way that you become an ally is you have to, once you have to be aware, you have to learn about what's going on. So you viewed that 8 minutes and 46 seconds, I believe. But you know, what other images have you seen and maybe dismissed? You know, what other things have you witnessed and hadn't really meaningfully paused to digest what is happening in front of you? what are you really desensitized to, right? And so take a moment and really, again, learn about the context of why, as Ryan said, go upstream to why the bodies are coming downstream, right? Figure out why is this happening? Challenge yourself around what your implicit biases are. Learn about why you think a certain way. uh, um, Look at a group, whether they have pink hair. Why do you feel people with pink hair are this way? Like, where does that come from? So doing a bit of self-discovery around who you are, because we're all flawed. We all have been conditioned in some way to think and approach problems a certain way. That doesn't mean it's always right, but we need to understand, well, why is that happening? And then you need to be aware that you do that you actually are approaching that situation that way, because you can't change a behavior you're not aware of. And then, again, I can't reiterate enough, again, learning about the concepts, the definitions. What is racism? How is it manifesting in the space that you're in? And what are the structures that you are a part of that are either victims of or victimizing, perhaps? And that's where you can start. So being an ally, just acknowledging and understanding. Your next, natural evolution is then becoming an advocate, right? And so what does that mean? That means that you have learned that you are willing to lead and guide uncomfortable conversations around these concepts. You're ready to challenge others and help them become allies, or just really understand, so we can all, and allies just mean, can we all live together? Do we even really want to get along? Just having those conversations. And then, advocacy is also around leveraging your position of power, and everybody has one. That doesn't mean you're the CEO of the gathering spot to be powerful. Your power is how you define it in a space, what your passion is, and what you want to work on and how you want to do it. And finally, then there's experts, right? And so you look for help, talk to those who know more, invite them into your spheres to help you with your advocacy work, as well as even your allyship, and make sure that you connect. So show up at the gathering spot and have a conversation with someone at the bar, and explore these topics. So that's what I would tell people if asked that question.
Thank you, Dr. Franks.
I mean, this is another topic that I agree fully with Dr. Franks. I mean, allyship and really just leaning into these topics is what's necessary. I mean, it's an active thing that's needed. Identification of the problem isn't enough in this space, and I would offer isn't enough in really any space. So you've got to move beyond, yes, knowing about these issues, and then beginning to think about what you can do about them. I'm a person that tends to try to impact the things that are immediately around me, the friends and family, the people that I have the opportunity to interact with on a consistent basis, and don't try to boil the ocean. I mean, these are very difficult and dense issues to navigate through. But if there is any way that you can empower someone that would not have had the opportunity to do whatever it is that you are doing, a lot of ways that you would not imagine how far that simple act, what will feel simple, really goes for folks. Again, I mean, it's really hard for folks to become something that they haven't seen or been able to experience before. And so if you can be the person that opens the door to a new experience, that is a revolutionary act, right? Mm-hmm. And something that shouldn't be downplayed. And really, really and truly, I think if we had more folks in our communities that were being intentional in that way, we would see some of these issues. I don't like to talk in ways that suggest that there is ever a point of conclusion with any of this work. I think we're always going to be negotiating the best way forward. But I think that we'll be in a place, generally speaking, that more folks will feel better about than where we are now. So talk to the folks around you and have those tough conversations. And know that just because you've identified it, and I think in a room of a ton of folks that are medical professionals, IDing that someone is sick is not the same thing as treating the illness. Mm-hmm. And that I think holds true when you're talking about racism and, or again, any other issue connected to social justice.
Thank you. I appreciate it. I wanted to invite people to go ahead and you can put any question you might have in the chat, and we'll start trying to field those. I'll ask one that has been has already been submitted earlier. This is from one of our chaplains, and many of us are in spiritual health and then across other disciplines, of course, on the call. And so I did have a spiritual health question that I'll ask after Maurice Applebaum, who is one of our chaplains in New York. He does we have an online program for clinical pastoral education. One is, where do the racial disparities in healthcare manifest most profoundly? I.e., is it more mental health than cardiac care? Is it uniform across all healthcare issues and facilities, would you say? I imagine that's a Dr. Franks question.
I would say it's everywhere. And we all are challenged to understand the level of the gap. And the gap is going to be different in different places. So cardiovascular care in this practice may be equitable and there's no disparity. But then if you go over to this other place, there may be a huge disparity in the way that they approach their patients with cardiovascular care. The whole point is people are not really watching if they're doing that or not. You know, where's the feedback to them? Like, so I'll even use myself as an example. It is my aspiration to provide, it is my intention to provide equitable care. How do I know that I'm not doing that? Or that I am doing that, right? So if we're gonna be meaningful and help healthcare providers really address health disparities, because we know about it in outcomes. There's studies and outcomes, that data is tracked. You can go to the CDC website, you can go to Health and Human Services, Office of Minority Health. You can go to a number of websites that have the ability to track outcomes, but how do you drill that back to is it the healthcare organization? Is it the individual clinician who is making a decision, right? That is the root cause of why this disparity exists in this particular place. So I say all that to say is we have a great opportunity to really why it's happening, and really need to hit it from all different aspects. But I don't think that there's any place we're doing it perfectly.
Dr. Franks, what would you say the feedback from patients is limited because they don't want to challenge the doctor to tell them whether they're doing a good job or not, or does that fall in this purview?
Well, you know, it's interesting because I think that again, aims of quality improvement, and one of them is also patient-centered care. And the way that we actually do give feedback, and that's our satisfaction surveys, right? You know, we are a culture of feedback at this point in time. And so now leveraging that in healthcare and some of that is subjective, but it is what it is. What do we do with that information? And, you know, there's also perception, reality, communication breakdown. It's so much behind that, but it is some data to reflect on, and being open to all streams of data to really reflect on what are we, if we're not getting it right, what are we going to do to get it right? So yes, your patients are powerful feedback. They don't always have the same experience or feel the same level of empowerment to challenge, or even, and some do, that's not to say that some don't, to let you know how they feel or what they feel they're being subjected to.
And you know, there's even a racial component to that, of course, because there's some people who don't think that they have agency to question the doctor, that the doctor knows all. And so they just kind of leave it there, and you won't get the information because they're even messages they've received historically.
Yeah. And and that's a powerful statement. And that's why advocacy is needed everywhere. That person who has that belief that's rooted in something that's been internalized through messages they have received all their life is why they have that behavior, right? And so how do we advocate for that person to ask the right questions? So as a healthcare provider, I have to be perceptive. You know, how do I get that? How am I assured that the patient understood what I said?
Right. And
what are the tools that I have to use? It's on me as well. And so it's difficult, right? So I think every healthcare provider has that intention, or at least that's my aspirational belief. That we are well intentioned in that way, but sometimes the conditions in which even we practice, pressures of fast turnover, everything is more complex. We may not do that due diligence in the way that we intend to. We may miss those signals when people acknowledge what we say, but they really don't understand it. So there's lots of opportunity, again, from a systemic standpoint.
Yes.
We optimize the environments that we interact, optimize the access to the right people, and so that everyone can get what they need.
And the investment of seeing through a lens that might be very different than yours, because that we're coming back around to the earlier part of the conversation. If my experience is not your experience, I have to really value the system you come from and the experiences you have that are not mine, so that my response is not, well, you just need to get this together. You need to take your medicine. And when a person doesn't have enough money to get the medicine, or a ride to the place to get the medicine, or a home to actually to go somewhere and rest so that their medicine can, take place. Those are so many layers that we have to be sensitive to when we're engaged.
That's true. So, and that's just part of it. Not only do we have to be sensitive to it, pick up on it, then what's out there for me to help my patient address that? That's the structured systemic part, right?
Yes.
How can I be positioned to give them a solution or help them towards that solution?
Yes, thank you. Ryan, I don't know if you have anything. I know some of the hospital conversation is here in focus, and a lot of the questions coming kind of have some of that focus. I'd like to raise one of the questions that just came in from one of our CPE educators and directors. With the new administration coming in, we have an opportunity to advocate for changes in healthcare policy. What would you say are top priorities for systemic change for healthcare that can help address disparities? The top priorities. If they're not different than what we've already said, if there was something you might add.
I'd be interested to hear Ryan's response as a non-healthcare provider, what he thinks the priorities are.
Yeah.
I was going to say there's an old stereotype about lawyers believing that they can answer any question. And I was going to say, Dr. Franks. Yeah. No, I mean, I'm excited about the new administration. I'm actually in DC right now. And I think that there are a number of new initiatives that we've heard about. I'm squarely focused right now, both in Atlanta and DC, on making sure that folks have access to basic information. I won't even talk about the practicing healthcare and kind of that lane of the conversation. But what we hear a lot inside of the club is just folks feeling like they don't have access to information, particularly as it relates to concerns around the vaccine and treatment of COVID broadly. So what I'm hopeful for in a new administration is that we're going to have better communication between those that are in the scientific and medical communities and folks like me that are outside of those communities on exactly what is happening in real time, but also giving plain information to folks in a way that's easily digestible and allows them to make good decisions for themselves and for their families. I unfortunately think, given the polarized political environment that we're in right now, that we're not able to have those very clear lines of communication, and that's what I'm optimistic about will begin to change in the next several, weeks.
Thank you. Given that we do have a quite a few spiritual health folks, chaplains, and folks in ministry here on the call. How would you let me speak for us, some of us, and if you have a difference, just put it in the chat. But when COVID hit, we found ourselves having to really shift in our roles a bit. We used to be at the bedside with persons who were dying. We were managing large families and working alongside with clinicians, and all of a sudden, we still did a bit of that, but we became the term essential worker became a new reality for us too, because we were helping to nurture and support and walk alongside doctors and the nurses who were actually having to be right there, and they were getting burned out and still really being challenged. Could you speak to your sense or what you have witnessed, or the importance of that partnership with spiritual health and the other clinical staff?
Yeah, that has been, I agree, the toughest part of this pandemic is the removal of the in-person connection, and having it all funneled to just one person. And it was necessary. It's still necessary to really protect us as we continue to manage through how this virus spreads. Granted, we are in a different position because we know how to better protect ourselves directly interacting with these patients, but still limiting the actual density of the folks interacting is still also an opportunity for public health responsibility around this pandemic. But I think more than ever, you know, recognizing the value of every person who comes to the bedside and what they bring, because you know, I've seen patients who may connect with the EVS worker who comes in to pull their trash in more ways than the physician, the nurse, the respiratory therapist, or everyone else in their care. And it's just, you know, sometimes there is some advantage of having those varying personalities, and I think that spiritual.
Oh no. Oh, she just getting ready to say spiritual health too. Okay. Okay, so I think while Dr. Franks is probably going to have to reset, I'm going to read a question from CG Gim. And Ryan, I think you could chime in here until we get Dr. Franks back. Frontline healthcare workers and spiritual healthcare workers will be required at some point. Will be required. Went up. Okay, the vaccine is available against COVID-19 at Emory Healthcare. Given the need to fight the pandemic, as well as the history of racism, i.e. this Tuskegee experiment and many others, is U.S. healthcare and through leading research institutions, how would you respond to African American or spiritual healthcare professionals reticent to take the vaccine, yet feeling pressured to be inoculated?
I mean, I think it's important for us to start at a place of understanding. There's a long and very painful history that we have in this country where the fears that folks have about, in particular, you know, the concept of vaccines, they're real, and I think we should start the conversation with accepting the fact that although that may be frustrating, given that we have a public health crisis that's happening, that those fears are not born out of nowhere, right? They come from someplace. It goes honestly to my previous comments about us being able to get information out and have leaders in place that have a little bit more credibility than leaders that we may have, you know, been experiencing over the last several years, right? We need to make sure that our leaders understand that this is not a political issue. This isn't about what we think from a ideological perspective on policy. but they're really about our collective health, right? And I think that if folks can see that, that there will be adoption of the best health practices that that we'll see in any other community. But the trust that we're going to need to build is it's an important step for us to acknowledge that we need to take. There's going to need to be real money spent in this space to communicate to communities that have not been spoken to, and honestly, that I'm sure many on this call know do not have access to adequate health care right now, right? I mean, if you go back to the community that I was speaking about earlier, not only are there no medical facilities that are in that community, there are no grocery stores or even places for the children that we work with to sit down and dine. I mean, it's so for us to communicate to those communities, we're going to have to be very intentional and bring folks that they trust to give them plain information. I think it's as simple as that. I also, though, think that we need to begin to reframe my concern around particularly access to the vaccine is not so much around the safety of the vaccine, but about access to it. And I'm fearful that if this plays out, similarly to other resources that exist in our community, or really the lack of resources that exist in many communities, that the concern that we'll be faced with in the short term will not be about if folks believe that the vaccine is safe and in the best interest of their health, but if you can get access, and then what that means for other things in terms of access to work and any other part of life. I've been trying to keep up with that part of the conversation, because again, that's where I'm more concerned than I am about the safety aspects. I trust the medical community has produced and will continue to produce solutions that are safe, but can we get those solutions to, again, communities that have been isolated from all other resources for generations?
Thank you for that, Ryan. I really appreciate your perspective, your holistic look at that. Dr. Franks, would you like to chime in? I think you can figure what that question was about, or do you want me to?
I don't really have much more to add. I completely echo the sentiment and concern around access to the vaccine for, who we're calling essential workers, who we're calling essential or not, get what they need. So
I hear you. And Dr. Franks, we in spiritual health would probably like to hear the last thing you were saying when your Zoom cut out. You said, and spiritual health, but we don't.
Yeah, I lost it. I hope if it comes back, I'll certainly bring it back. I'm sorry about that.
It's about us working together and something. Okay.
Well, I'm certainly personally in my practice a big fan of spiritual health, and don't have as many of my friends at Emory Midtown will know, if they ever worked a shift with me, I'm quick to call. Yeah. Because quite honestly, it's all interconnected: emotional, spiritual, physical health. So many things manifest as physical complaints that are really emotional stress. And, I frankly, in the emergency department, can't give people the time they need to explore that. And so I try to provide them with additional access to people who can sit and listen, who can try to meet them where they are. In the brief time that we have to care for them in the emergency department. So I do value spiritual health. I value how they interact in the hospital. And I think, our healthcare actual clinicians probably don't take advantage of your services for their spiritual health and wellness as much as we advocate for the patients. So.
Thank you. I want to make sure I'm good on time, so if someone can help me. George, can you help me and maybe send a reminder, Cheryl, or for me, directly to me. An earlier question from one of the viewers was, how do you as panelists sustain yourself through this time, I guess?
I'll let Ryan.
I mean, this has been quite a year. I went into this year, I think, like many people, very excited about all of the things that we were building as an organization, all the places that we were going to expand to. And I mean, it's funny enough, I mean, the name of this business is The Gathering Spot, and the word gather has been, used more times this year in a negative context than I could have ever imagined. But I mean, I continue to stay very excited about the connections in the community that I have the privilege of being around each day. I learned so much from them, and when there have been points where I felt extremely down, there have been people around inside of the Gathering Spot and my family to be there. I mean, so my answer to this question is staying deeply kind of rooted with the people that I care about. I speak honestly, with them when I have concerns. My wife is actually she's an ICU nurse, and so this year has been taxing from that perspective. And we've had tough conversations about decisions for our family, but also we have a 9-month old daughter, and it's been difficult, but I at the end of the day, again, I remain optimistic because I think that the fundamental goodness that I've seen still, despite very tough circumstances, and really when folks didn't have the resources to give whatever it was that they were giving, whether it was time or money, I've seen consistently this year that continue to come through. So that keeps me energized, and with the belief that we'll get through this moment and this will pass.
Ryan, while I have you, thank you so much. There was a question specifically about the Gathering Spot, and then I'll come to Dr. Franks if she would like to tell us how she sustains herself through this. But the question was, are Black healthcare professionals at the Gathering Spot talking about the merits or disadvantages of the Affordable Care Act and its promise toward equity?
We have a lot of conversations, particularly about that piece of legislation, because I mean, I think it's fair to say at this point that there's still opportunities there. And so, yes, we've hosted a couple of conversations about it publicly, but there's actually a group of, we call them circles in our context, where groups meet around smaller issues. There's actually a group of medical professionals that meet not fully to discuss just the Affordable Care Act, but just concerns around issues in healthcare broadly. So yes, in short, and I think it's something that as we continue to move into the public discussion, particularly concerning the vaccine, that we will be very active, both given the population of people that are members of the club, but then also the broader neighborhood that we're part of, where there are extreme concerns that we have about the future prospects of the broader community if we don't get first good information to them, and then actual treatment and different access to things that y'all know far more about than what I do, but we want to make sure that we get the information to.
Thank you. Dr. Franks, did you want to talk about what sustains, or you want me to ask you another question?
Just briefly, I'll just say, leaning on my foundations, I mean, most of which has been my family and my faith. I do think the pause of quarantine had helped, was a little bit of a positive for me, just to slow down and appreciate how I'm blessed, and that re-energized and sustained me as well. Yeah. And so, I didn't stop going to work, whether it was the office or the clinic. Right. I showed up every day, and that's not everybody's reality, or rather privileged. But I did what I needed to do to be present, to support, whether I was in a supportive role or an active care role. And taking the time to really spend to explain to people what was going on. I just, all of that was very important to just, and also to connect to people that in a new way around what was going on. So that continues to sustain me in this, at this time. Thank you for asking.
Thank you. One of the questions, another question for you, Dr. Franks. One of our directors here talks about the fact that, we are working to enhance our curriculum to address issues of race, racism, racial disparities in healthcare. And there's curiosity about how Emory is doing anything similar for their medical trainees that come in. Is it a very focused part of their training, and what can we maybe learn from each other or do to help support each other?
I'm going to say, and not as an expert in the graduate medical education office, that there's probably a no, but there's work towards that. There's certainly have been an increase in conversation through webinar series, through some of that. Whether there's intentional curriculum, I actually think it might be in development, but we have not solved that problem. We still have that gap. But I know that there are strategic experts who are working in that space to explore how can we elevate the education of the medical students. And what I will say is the American Medical Association recently established a Center of Health Equity and has put in and named a director. It has put in some real intention around what is racism, what is health equity, and what does it mean in the space of the House of Medicine. And not to overshadow the ongoing mission, the historical mission of the National Medical Association, who has been leading and advocating in the space of health equity for all, specifically African Americans, but really for all. So, I mean, there's folks who've been in the game. Like I said before, this is not a new conversation, but there's new folks stepping up. And so I think we all, and I appreciate that you all are exploring that and trying to create that space. If there's anyone I can connect to you and to help develop that, I certainly will do that part.
I will certainly follow up with you. I know that historically we've been able to be privileged to be a part of the training of new medical trainees. It was really a powerful opportunity and partnership, and so I would definitely follow up. We have about 15 minutes left, and I can read a few more of these questions, and then George, I would like to maybe reserve 5 minutes at the end there for you to speak to us at our summit or time today. Ryan, I guess this is a basic question. How can those who are interested in becoming members of the Gathering Spot, become members of the Gathering Spot?
I'll be brief here, and I thank you for this question, but really the process begins and ends online. If you go to thegatheringspot.club, or if you follow us on social media, there's information about the club. And again, we're based in Atlanta, but where I am in DC is our second location. We're building one in Los Angeles.
A question was, why should access to the vaccine be trusted when there's no access to groceries or healthcare?
Great question. I don't have an answer for that one.
Yeah, that's a big one, right?
I mean, I think the tough answer to that question is that it shouldn't be, right? I mean, again, we got to face where folks are and not talk about this in a way that isn't congruent to the lived experiences of people in our communities. I think it's also important to frame it that way too. These are people first that are in our communities, right? I think that we have a very interesting habit of figuring out, even though physically we are not that far from one another, of imagining, places in our cities that are not a part of our community. And so that I think, again, is not the way that we should be looking at this, particularly if you want to attack a public health crisis. From what I understand from the folks that work in this space, is that we've got to view cities and states and countries as really being borderless in a sense, and speak to people plainly. But when you do that examination and have those conversations, there are folks that absolutely, given the generational issues that have existed, these are not new social conditions for many people, they shouldn't trust that this is going to be something that is beneficial if you've seen very little things that that have been over the years. I mean, I'll give you one more example from the neighborhood that we're in. In 1992, there was a community benefits agreement signed between the Vine City and kind of English Avenue communities and the stadium. I won't bore everyone with going into the full details here, but if you go into Vine City right now, which has received more resources than what English Avenue has, these are both communities that are about 1 square mile directly next to one another. What's happened in Vine City since '92, that there are structures that were built that were never populated with anything. They're just, they were, I mean, literally almost like movie sets, walls built and now trees that have grown because the spirit and the actual execution of those agreements was never fulfilled.
Yeah.
Right. And so to go back into the communities where there are structures where there was something specifically given to the community as a benefit that was supposed to happen, and say, well, no, we have something else, when what those communities have seen is that structure be built and torn down and another structure be built, and not much really, you know, has changed. And so we've got to have, again, I think, a very plain conversation about what folks have seen, and remain very patient. And another way of saying that is, do not get frustrated when we hear responses that will feel like, you know, are against the interests of you know, everyone's public health, but they're rooted in, again, a very real lived experience.
There's one question about how might a safe zone be created where people are comfortable enough to discuss issues of racism and or related when you are a minority, and there are policies in places that say you cannot discuss this in the workplace but outside the workplace. Are there ways to create safe zones? It might be more than what you all can answer, but what are your thoughts?
So, you know, it always starts with your relationships with the individuals that, you know, you work with. And I think, you know, rightfully so, I think organizations maybe make those suggestions or give that direction because they don't want any adverse outcome of those conversations to impact the work environment. Exactly. And so sometimes instead of saying not to do it, then, you know, we have to follow that with, well, let's provide you with constructive forums to do that. And this is one of them, you know, and how do we encourage it that way? So it's one, you know, it's not letting it get in the middle of, we have to be hands-on in what we're doing in our work, but also provide the outlets if we're not encouraging that at the time we're working because they do need to be addressed, especially when it's current events, hot topics, pressure points.
Yes.
And give people the outlets that they need constructively.
Yeah, I don't believe in those policies, and I really don't understand how organizations believe that they can actually be executed. I mean, folks are there's an experience that everyone has that is brought to the table no matter what it is that you're doing, and to say that you can't speak about that or can't be engaged, I mean, it's going to be engaged anyway. And so I agree with Dr. Franks. You've got to create a framework to have those conversations be productive, but to say that they shouldn't happen, again, I think is outside the really the bounds of what's able to be accomplished if people are going to interact with one another. I'll say too, though, I mean, for a person that's concerned about having that conversation with the institution, is that there is a profound business case for having these discussions. And so to the extent that you can, try to make the conversation quantitative before you make it qualitative, because there is no program that I have seen that is effective, that stays tied to anything that is racist or you know, against folks being able to fully see one another. So I think that to the extent that you can quantify that and make a business case for why a practice should change, I've seen people enter the conversation there, and that gives room for the more qualitative parts of the discussion to be a part of what's considered.
Thank you, Ryan. And I'll make one comment, and then I'll invite our executive director to join us and to help us move toward a close. But I want to highlight, I guess, the pride I feel in our spiritual health department during these hot topics, understanding even when the election was on the horizon, the stress everybody was feeling. We were very intentional to lean into conversations with ourselves first, knowing that we serve the entire Emory population here, I mean, across the healthcare system, and that we are supportive of all people, and with our own integrity, making sure that we were not losing our integrity in terms of our voice, our agency, our prophetic, role. How to make sure that we were valuing and allowing the sacred worth of all people to be recognized, while at the same time making sure that Emory's mission and our values were what would guide our way of supporting and helping people to respect and regard everyone and where they land. If there was anything that was going to be contrary to recognition of someone's value and their worth, then that's where our prophetic voice of making sure we're challenging to help guide and center and balance that would come, into play. That was what would be our beacon. And so I'm proud of us to have been able to do that. And it yielded wonderful outcomes for ourselves, being centered, less stress, while we also supported those who worked in the healthcare system. So I think that effort was of benefit. Ryan and Nicole, or Dr. Franks, Mr. Wilson, or Attorney Wilson, I want to thank you both and allow our Executive Director, Dr. Grant, to speak now.
Thank you, Bridget. I just take up where you were pointing toward, which is the intersection of justice and care, and in particular in our world in healthcare, is something that is been, sort of in the shadows, and I think bringing it into the light, as we've done today, and a program like this has been a great contribution. I will say to you, Ryan Wilson, the JD degree, Juris Doctor, I like to think of that as a doctor of justice, right? So,
Yeah.
I mean, there is a place for a counselor at law in the public forum. My father was a counselor at law, and he was a civil rights attorney. So I really appreciate you being with us. Welcome to the Emory University and Emory Healthcare family. You've really stepped in, and you had some reservation when I first asked you, but I think I was found to be right by asking you to be with us. Dr. Franks, you are a mainstay in Emory, top executive, and just a role model for all of us. And I'm grateful for your leadership and what you bring to all of us in terms of your experiences and your expertise.
Thank you.
Bridget, well done. This was a great event, and I'm very appreciative of the persons who have joined us today. We got up over 85 people who joined us, and we are going to post this program on our website, Emory Spiritual Health. And today was a great day, and thank you so very much for joining us. And look again for us, Spiritual Health Grand Rounds and Symposiums. And I wish you a great day.